Hello, everyone. Welcome back to another episode of BioNexus Health Presents Autism Uprooted podcast series. Now, today's episode is going to be unique. We have what I've been requested to do is to answer a few important questions from mothers of children on the spectrum from around the world. We've chosen to do this a few countries at a time. So today, I believe we have mothers from Pakistan, Australia, Norway, Ireland, Middle East. I think in the Middle East from Saudi Arabia, specifically speaking. So we have a cluster of moms from these different countries, and we will be addressing certain important questions regarding treatment and progress, as well as how to handle flares and Herxheimer reactions, how to distinguish Herxheimer reactions from flare-ups, how to identify triggers, and much more. So please join me in welcoming everyone to today's podcast. It should be a very educational and invaluable episode, I believe.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
I think everyone is settling down, right? So welcome moms. I don't know if there are any dads, so, welcome dads as well. So we'll begin at the beginning. It was the first section I received. Again, Benny, this is really good. All right. It says reactions and emergencies. If a child accidentally eats something moldy or visits a mall for 2 or more hours that's heavily moldy, what can we do urgently to minimize the effect? Okay. Accidentally eating something moldy, as long as you're doing enzymes and binders, if you are already started on your protocol, you'll be fine. Nothing to worry about, right? Just keep up with your protocol as normal. If possible, eating, this is for eating, right? Not being exposed environmentally, because eating something moldy is different from being exposed to mold in your environment. Next is if you visit a mall that is heavily moldy. Well, if that's an accident, that's different. If you know that the mall is moldy, then there's no reason to go to the mall with your child. So if it is an accident and the mall is moldy, then what you'll do is hopefully you will always leave your house after having done at least 1 dose of the binder, nasal spray, and your herbal cocktail. So this way you are protected before you leave the house. I always say, if you cannot get 3 doses in on regular school days, then it's important to get the 2 doses in, which is before school and after school. Okay, any kind of school, special school, ABA school, regular school, going to the school system, any kind of school, any kind of outing, right? For example, going to grandma's house, going somewhere to visit. If anyone is having a conversation, please mute your mic. I think everyone should mute their mic at this time. And if you have anything to say, then please unmute yourself. And we can proceed. Just 1 second. I'm going to pause the recording for 1 moment. I just had to get sorry. All right. Now, so before you've left the house for any kind of outing, you have these things on board. You have given your child the 3 things I mentioned. Do the same after the child comes back home from school or from your outing. Okay. Now, additionally, if you suspect mold, if the school, for example, has a flat roof, if you suspect for any other reason, could possibly be water damage. Now, remember, it's not just water damage. Okay. Please understand that if the school or the mall or grandma's house or uncle's house or wherever you guys are going, if there are any VOCs, meaning any volatile organic compounds, like freshly painted, a new couch has been bought, it's a new bed, or it's a new car, something to that effect, biotoxin illness flare-ups can happen with exposure to VOCs as well. So please keep that in mind. But again, as long as you have your first dose before leaving, and as soon as you return, try to keep your visit minimum. And when you return, remember to leave your shoes and socks at the door. When you come in, if you can shower, obviously change the clothes, shower. Especially your child, if you don't have time to do all that, you need to be sure that there are at least air purifiers in the house, because both of you are bringing in contaminants from wherever you've been, right? It's not that you did not bring the contaminants in, it was only your child who was affected. As a parent, you may not have any symptoms, yes, but if you are around your child with contaminated clothing, etc., then you can contaminate his clothing even after the shower. So just keep that in mind. Additional information for you. So after the child is all cleaned up, washed up, showered, then give the second dose of the binder, the nasal spray, and the herbal cocktail. So before and after, and that will minimize any detrimental effects from the exposure. Okay, then the ones that I've highlighted, I've highlighted a few. I won't be able to get to all. Now, if a child accidentally takes gluten, casein, anything we can do to minimize, correct? All right. So if there is accidental ingestion, make sure it's accidental. I hear all kinds of different versions of accidental. One version is once a week we have a cheat day. Well, that's not allowed. We will hopefully get to that as the immune system matures, as the immune system gets stronger. But no cheat days. If you are doing a gluten and casein-free diet as indicated on your current protocol, please continue. And if there is anything truly accidental, then yes, digestive enzymes are the only thing that is required. A binder, the binders that you're doing should be at their own time. You don't have to hurry up and he's not ingesting something like mold or not exposed to mold. So just digestive enzymes, give like an extra dose. Okay, so that should be good enough, and then continue on the protocol. All right, now remember that this ingestion has happened. So if you see a minor flare, don't presume it is something on the protocol. Okay, I'm just looking at the chat. I'm going to close that. All right, next. How to identify, this is important, how to identify if a flare has started. What symptoms to check? Should we always take 15 minutes consultation? Should we use ibuprofen? What is the dosage? Is there any specific change in protocol we need to make? Actually, let me go back to the prior question. I rarely add gluten back in, rarely. Casein, I do add that back in, right? After maybe a year or so, depending, it's very individualized, but casein, modified casein, as in making SCD yogurt, I do add that back in. Camel milk will be added, as we know, it's really not your typical casein with camel milk, but that will be added at the appropriate time as well. Some of the children are already on camel milk, and it is difficult to get them off because, as we know, adjusting the diet of our kids is very hard, especially the ones that are picky eaters. So I will be teaching how to make yogurt that is acceptable for our kids. All right, then how to identify the flare. So now let's talk about the flare. So flare symptoms, I think everyone knows how to identify if a flare has started, right? If you have symptoms that return, right? All of the symptoms, let's see, who here has experienced a flare? Would anyone like to speak about it? Annie, you want to talk about a flare? Go ahead.
Right. Hi. We had experience of flare. So what we saw was frequent visits to the toilet, peeing, like frequent visits, like every half hour or
yes.
every hour, hourly visits. Then we also experienced something called ticks. So throat
yes.
clearing and making certain noises out of the mouth, and also facial tics as well. Sometimes they get really cranky as well, like temper tantrums, meltdowns, things like that. They refuse to eat, or sometimes they're just gonna lose a skill.
Okay.
So that was our symptoms.
Okay. So question, Annie, question. So these
yes.
are your son's symptoms per se, right? So you just saw
yes.
the symptoms come back or the symptoms intensify.
Yes, that's correct.
Okay.
It was, and after that, sorry to put you, after that we noticed was possibly, it was sort of controlled with the antibiotics, and Nurofen sort of helped with the flare-ups before we went in the protocol. So that was our sort of go-to treatment for it.
Yes,
so
yes, that's what I've heard. Correct. So we'll talk about antibiotics and ibuprofen, etc. But yes, so just like Annie said, a flare-up is pretty much just that. It's a flare-up of symptoms, right? You have a child, who is kind of at a cruising speed, may not be perfect, may have, the basic underlying symptoms are there, the autism symptoms are there, and then suddenly you see an increase, an uptick in the symptoms. It could be a few symptoms, could be all symptoms. For myself personally, Brian had vocal tics. He would go, and he also had eye blinking, facial grimacing, as well as head shaking tics. So when that happened, we did not have all of those with that intensity every single day. So if he would come back from, this happened once, he had a really good friend, and I had managed to, I had a really good friend, and I had managed to organize a play date with her son, because, just trying to get some socialization. And I actually remember Gary, amazing athlete, completely neurotypical. He had a little brother who was severely autistic. That's how I knew the family. And, so mom sent Gary over to play with Brian. He was maybe 1 year older. I thought he would be great. Long story short, Gary was a strep carrier. No symptoms. He had not recently recovered, but he was a strep carrier. And next day morning, Brian came down with heavy duty motor tics, vocal tics. His pupils had that deer in the headlight look, which that there is, fresh inflammation happening in the brain at that point. And it was just, then he was also paranoid. I vividly recall Brian holding on to the front door and screaming because he did not want to go to school. He's like, no, he was screaming. And when we asked why, it was paranoia. It was paranoid thoughts that one of his friends, one of the girls in class who adored him, she was neurotypical, she adored him, Emily, is going to hurt him. She's saying bad things about him. So this was just, so I knew that something had happened, and I was eventually able to pin it down to Gary being a strep carrier, and that was the end of those play dates. But so what did I do? What I did was, all those years ago, options were available, right? Antibiotics. Now, but remember, there was no proof that Brian had acquired strep. Okay, there was no, I did not even think about running labs. No, I did not, because we had just had labs, and I did not want to stick a needle in him again. So what we did was we just increased his, obviously kept him home from school for a few days. He had a medical plan in school that if there are any flare-ups, he's not coming to school. And my patients knew that if I need to reschedule for the weekend, that's fine if I have to take care of my son. So we were all set with that. So what I did was, the first thing I did was I gave him binder. I gave him the Daily Ohm blend. So that handles, I did not know at this time it was strep, okay? I knew there was some microbial trigger that had been introduced. Could be me, could be my husband, could be anyone, someone at school. So you have to, before you know what the trigger is, since you have your full protocol, right? Actually not many, many of you haven't managed to build up to the antimicrobial section. That seems to be the problem, because those of you who have built up to the antimicrobial section don't see these kind of flare-ups anymore. So let's divvy that up. Okay, now we had already built up to the antimicrobial, and we were on the full protocol, everything. So he had his morning and afternoon dosage. In the evening, when his friend came to play, this is what happened. Next day morning, he had his binder, he had his minerals, magnesium, the full protocol, pretty much. It was on board for him. So what I did was I gave him an extra dose of the Daily Ohm blend. Okay. So an extra dose of the Daily Ohm blend, and I put him in an Epsom salt bath, and I added lavender essential oil to it, like, maybe 5-10 drops of lavender essential oil, right? And I see Asma smiling. Is this resonating with you?
No, I was thinking like maybe we can try Ohm blend as well. We don't have it yet.
I see. Okay, sure. Yeah, of course. So yes, so Daily Ohm blend is multimicrobial. It's I actually made it for myself and my extended family members. It's just something that is for the caregivers to keep themselves healthy. So I gave Brian an extra dose of that along with the Epsom salt bath, lavender. I sat him down to watch, he used to watch like back in the day, the Wiggles. Then he used to watch Tom and Jerry, anything to make him happy, to make him laugh and happy and relaxed. So we did all that. And it took about 3 days to see the symptoms. Now, one advantage, one blessing was that Brian's never been aggressive, except, during these episodes of like paranoia, OCD, morbid thoughts. That's what, many of us want our children to speak. And speech came as soon as his Lyme disease was treated. He was still in a wheelchair, but speech came in sentences. He had words, but speech came in small sentences. And unfortunately, I guess it was a mixed blessing, because we, all of his fears and OCDs and morbid thoughts, that's what he used to speak about. Like we have a cemetery nearby. He would talk about bodies rotting in the cemetery for no reason. This is, a very peaceful, happy kid overall. So I knew that flare up was happening. I remember reading about this on PANDAS groups. In those days, it was still called PANDAS. And I remember reading about this and I'm like, whoa, that's really extreme. Not my kid, not going to happen. And then I saw it happen. So at least I knew that it had happened to other families, and it is quite possible, to think that many mothers describe it. It was as if my child was possessed. What is going on, with my child? But yes, so it took about 3 days. Then, as I started mentoring with Dr. Trifoletti, I saw that almost every patient with PANDAS flare, antibiotics and ibuprofen were prescribed. Now, antibiotics make no sense unless strep has been identified. You cannot assume it is a microbial trigger, okay? Because mold exposure, exposure to somebody else's strep, exposure to other environmental toxins, exposure to stress. One trigger for my son used to be bullying. He would come home, look really feverish and have all the symptoms that I described to you. And then when he would relax, calm down, I would ask him, what happened? And then I heard that he was bullied at school. So that is a lot of stress for the child, and you will see symptoms coming back as a flare-up. So does he need antibiotics? No. It's not like, you have a child who is exposed to stress. It's not like magically the strep comes in and the strep, starts to grow in the body. That doesn't happen. Ibuprofen, yes, ibuprofen brings inflammation down, correct? Now, for those of you who feel the need to use ibuprofen just for functionality, just remember that 200 milligrams once a day should be the goal. If you can break it up into 100 milligrams twice a day for a little child, obviously it depends on age. I can explain to you by example, up until 18 years of age, all we needed was 200 milligrams a day for pain, for flare-ups, for whatever. Just 200 milligrams a day. Along with that, another example would be for inflammation. I had a quadruple tendon transplant surgery in my right hand. There's a scar here. I got into an accident and my thumb lost all function. It was just like kind of lost function, it lost an important muscle tendon, was just cut clean through. So we had to transfer tendons from here to help my thumb, right? To be able to become functional again. So it did, but it left a scar, many, many months of hand specialist, occupational therapy, etc. So now it's it's more or less functional. And I am right-handed. Luckily, I'm also ambidextrous, so I was able to use my left hand. I'm actually one of those who used to be lefty, and then you go to Catholic school, and they beat you with a ruler, and they make you right-handed. So that's what happened. I'm one of those. So for the first time in my life, that helped because I was able to continue see my patients and use my left hand. But right after the surgery, when I came back home, of course, they prescribe opioids as a pain medication for the intense pain. Once the anesthesia wears off, I did not take any. All I did was I took boswelliazine. I did Enhansa or curcumin. Enhansa is not available, so Mariva from Thorne is a good one. So I did Enhansa, boswellia, and then I did my anti-inflammatory herbals. That's all I did, and I was functional. It was fine. There was no pain. Okay, so ibuprofen is good to do once a day, and try doing natural anti-inflammatories. The formula NS1 blend is very anti-inflammatory. It is NS is neurological support 1. So that calms it brings the inflammation down in the brain. It has herbs that cross the blood-brain barrier. Now, keep in mind with NS1, it has skullcap. So skullcap can be antimicrobial if any Lyme has been activated in the brain, for example, or any other microbes because of the stress as a trigger that's been activated in the brain, that is antimicrobial. Now, those of you who have not built up to the full protocol, you're not doing antimicrobial still, then you may have to use antibiotics if you feel it was strep. Oftentimes, parents will know. I think one of the moms here, I think it was, who was it? Who had a sore throat, cough and cold as well, and was, sleeping in the same bed as her son, who developed a reaction a few days later. So I'll explain the few days. Yeah, there was Hajra, right, Hajra? Yeah, okay. So and I'm going to. Okay, good. And Hajra actually received a little lesson in immunology that day, at the appointment. But often parents get confused when the child, and often many of our children share the same bed because it gives them comfort, they get some sleep. So if that happens, if you have anything going on and you know that it is bacteria, virus, etc., if it's a virus, what's the point of doing antibiotic? Makes no sense. If it is bacterial infection, okay, meaning that your fever is going to be a little bit higher. If you have secretions, right, they will be yellowish, a darker yellow, or maybe even a little bit of a greenish tinge. So it is leaning more towards bacterial than viral. That's when it is okay to use a low-dose antibiotic. I find that clarithromycin, again, I don't prescribe antibiotics, but this has been my experience. I found that clarithromycin 250 milligrams maximum. Now, this is my reference age will be, when was the first time we had to use that? Yeah, my reference age would be between 7 and 9 years of age, right? Younger than that, obviously your physician can calculate the dosage for you, but once a day, along with the ibuprofen, 200 milligrams at separate times. Don't give the antibiotic and ibuprofen together. That is at the most what's required. And now remember, I cannot give absolute answers because there are different scenarios. If you have done a blood test and you see that strep and mycoplasma numbers are very high, then, of course, you have to do a full course of antibiotics. But for a viral infection, there is no need of antibiotics. That is just abusing the gut. Now, is there any, okay, one more thing about ibuprofen and antibiotic. Always make sure with an antibiotic that you're doing it after eating. For ibuprofen, it has to be a sandwich, meaning not the sandwich literally. I mean, it needs to be food, ibuprofen, food again. So, ibuprofen is sandwiched between two snacks. Even if it is a few crackers, give the child crackers, ibuprofen, and then crackers again. Okay. Make sure you're doing your gut butter or at least minimum probiotics. Any part of this that needs further clarification. Good. So bottom line is, once you build up to your antimicrobials, once you build up to the full protocol, it is quite rare that you will see a flare-up because of microbial causes. It's rare. Is it possible? Anything's possible. But from what I hear in the past decade from parents, that coughs and colds are just pretty much gone or minimal, right? So at that time, you have to identify the trigger. What is the trigger? And I think I gave you most of the triggers, right? Grandma's house, new couch, new car, the new car smell, something new at school, swimming pool, chlorine, vaccine, mom and dad being sick, siblings being sick, being bullied in school, mold exposure, we already said. So there are various triggers. It's very important to identify the trigger, okay, and keep the child calm. Actually, I think more important than keeping the child calm is you stay calm, because it's very difficult to see your child in full flare-up. Now just understand, a flare-up does not mean there is damage happening, okay? A flare-up literally means it's a flare-up, meaning symptoms have just come back because of stress. It doesn't mean that there is, a whole lot of damage happening. We have to stop this right now. If I don't stop this right now, I'm a bad parent. That doesn't work like that. I promised I would explain about the delayed reaction. So often what happens is that, so you have a parent who had this cough and cold and sore throat, kid is sleeping, nothing happened for 3 to 4 days. And in the 3 to 4 days, someone doing medication is going to get better. So in your mind, you're better, and then your child started having a flare. So that's where the confusion happens, right? So now remember, what is PANS? PANS is an autoimmune condition, correct? Everyone here understands that it's autoimmune. So what is the meaning of autoimmune? Autoimmune means that your immune system is making extra antibodies. And in the case of PANDAS, research has shown that these are attacking the brain, right? Some people have thyroid problems like Hashimoto's. So those antibodies attack the thyroid. So our kids have PANDAS type issues. So the antibodies are anti-neuronal antibodies. They attack the brain. Now, not everybody is able to do the Cunningham panel. Like Brian was actually one of the research subjects when Dr. Madeline Cunningham in Idaho was doing the research. So, I was in close touch with her. We actually spoke at the same conference in the UK in 2019. So it was fantastic to meet Madeline as well. And we actually spoke about adults who seem to have anti-neuronal antibodies, not seem to have, they have anti-neuronal antibodies, because those adults who could afford the testing, we have, I was able to run the test for them, and we saw, you know, within 2 hours, the antibodies begin to rise within 2 hours of exposure. When they start to rise, then they rise. And I'm sorry, not within 2 hours of exposure, pardon me. That's the other part of the immune system, forget that. So once the antibodies start being manufactured, then every 2 hours, I'll give you Brian's example. Every 2 hours, we had 6,000, between 6,000 to 12,000 antibodies that were being produced. That is a lot of friendly fire for the brain, your own immune system attacking the brain, right? You know, we had anti-dopamine 1 and anti-dopamine 2 receptor antibodies. That's why between 6 and 12,000, depending on which one I'm looking at. So that makes sense that the brain is getting inflamed because, you know, it's constantly getting these antibody bullets are going in and irritating the basal ganglia in the brain. Okay, this is all, you know, research oriented. There are many papers published. So that is what is happening in a flare. Now, antibodies usually take a few days to develop. It is not an immediate response. This is your adaptive or acquired immune system that comes into play. So if you see a flare up a few days after, then you should always consider what happened a few days ago. Okay. Similarly, for food, there is the IgG response, the IgG3, IgG4. Those are also delayed responses to food. Anytime you see a flare-up which is accompanied with, not with impetigo, which is a strep rash, but if it is accompanied with things like hives, or, you know, erythema migrans, or like red patches, which are going from, you know, sometimes it's a bit over here, sometimes a bit over there. This is a food reaction. It is nothing to do, you know, you don't have to put your child on antibiotics. You don't even have to put them on ibuprofen. One mom from Ireland, you know, recently, just yesterday, I think, emailed me photographs of her son. This is Francis, with big hives, and said, you know, is this rash from the nasal spray? So I explained, no, there is no connection. You know, nasal spray is just local, because she started the nasal spray and she thought, you know, this was a flare up. You know, it was a die-off, a Herxheimer reaction, but clearly it was a food associated response, right? So that is something else to keep in mind. Now, I was talking about your inborn immune system and inflammation. So the inborn, the innate immune system reacts pretty quickly. And what research has shown is within an hour to 90 minutes, the cytokine storm starts. So that is why, you know, when you're exposed to mold or any other trigger for biotoxin illness, this is what you will see in our children. Now, so that I think answers this whole flare. Now, what specific change in protocol you need to make for if this hasn't covered it, and if you are not on the full antimicrobial section, then please do schedule a 15-minute, because, you know, and remember, for every appointment of mine, please have your notebook ready, okay? I don't allow any kind of audio or visual recording for regulatory purposes. It's not allowed as office policy as well. So have a notebook ready, and you know, by all means, make some notes as you need, take some notes rather. And I always go through each and every supplement and the function of that supplement. And it's important that you understand. Okay, now, good. So far, so good.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.